David, we're seeing a lot of hospitals and physicians coming together and aligning with one another. Why is that happening?
Well, there's two things that are going on. One, from a federal level, we've got accountable care organization legislation that looks like it's going to be moving forward, but no one's really certain. But from a federal level, that's pushing hospitals to align with one another so they can take risk in an accountable care organization, improve quality, and decrease cost. Second, from a federal level, they have incentives for electronic medical records. The electronic medical records need to be used across the hospital and physician enterprise to be able to have a truly integrated electronic medical record, and there's incentives for that. So there's money being paid by the federal government to do that. And then the second major reason is that the private payers are also looking to have some kind of risk-based reimbursement for integrated hospital providers. I've talked to the CEO in upstate New York, and they're doing bundled care. And in California, at a recent conference, they're doing old-style capitation risk, where they take all the hospital dollars, the physician dollars, and even the medical dollars, and they're moving toward risk-based payment methodologies, some around physicians and others around fully integrated risk. So your private payers are getting into this and pushing risk as well. And in order to manage that risk, and either from a federal level or from the private payer level, they need good systems to bring things together, and physician and hospitals are aligning, and they're aligning not just organizationally but also from an information perspective.
So Kyle, you've seen this alignment firsthand with a number of clients, and is there a gap between alignment and integration?
Yeah, there is. So historically, the word's always been physician alignment. We need to be better aligned with our physician practices so that the physicians are involved in our clinical protocols, so the physicians are involved in how the governance structure is set up within the health system, so the physicians are involved in what we're trying to do as a health system. Where we're going is creating an environment where alignment isn't enough. We need to have true and better integration of the doctors into the health system, the physician practice. So in the physician, we have the physician practice. They'll have its own billing system. It'll have its own practice management system, and often it'll have its own EMR system. You'll have similar systems over on the hospital side, including the billing system, the management system in the hospital. You've got operating rooms. You've got a operating room system. You've got all these different pieces of software and hardware that are managing the business and the clinical flow of patients within this health system. Historically, those two systems have not talked with each other very well at all. So even though we have, quote, maybe employed a lot of doctors to increase our alignment, we haven't taken the next step to integrate those physicians and the information that we receive from the systems that manage and run the physician practice into the health system. And a few examples. Let's just say I've built a cardiology program, and I can understand then the box that is my cardiology program inside the hospital. I know what that is. I understand the financials involved with it. I know what my costs are. I know what my revenues are. And that is the box for the hospital, the health system itself. Problem is, I still have this second box that's out here, which is the cardiology group that I've just employed to help build and grow this cardiology program. That's a separate box with often a red number at the bottom of that box. We haven't integrated or brought together the economics of the physician side of the equation and the hospital side of the equation. So in essence, we're looking at our cardiac service line in two separate boxes. And there hasn't been historically great understanding or information that brings those two boxes together. So when I'm talking about my cardiac service line from a health system, I'm looking at the inpatient value, the outpatient value, all the ancillary services around that, but then also the physicians and where they fall into that equation. So I may have a loss in the physician group related to, if you just look at specific revenues and physician costs and revenues that they're bringing in from their Part B billing. However, when you look at how those patients are flowing through the system and the overall programmatic growth of cardiology related to those doctors, we can see that there is a positive economic result. So just understanding the economics of the entire equation is important. It also means that you make different decisions strategically as you look at different opportunities. So alignment is great, but integration is really where we've got to go. It's really the next step of where we need to go in terms of what we're doing with our doctors.
It sounds like it makes sense, but is there a reason why it hasn't really caught on?
Well, we've always had the issue that you've got different billing systems, different kind of ways in which those work. And the second thing, there's often an us against them feeling that's out there, and so historically physicians have been reticent even to integrate that much and share the information that they have, especially the economic information with the health system. Now, the incentives and the environment as we move forward with some of the healthcare reform and also just the economic realities of how we're delivering care in America, that is going to naturally break down some of these barriers to integration.
David, when you're out there meeting with clients and you're talking to people and discussing with them about service line income statements, how do they react to the notion that you can combine these two sets together?
Well, they're very excited about it. The reason is it takes millions of dollars to switch out their legacy systems to a common platform, both on the income side and on the expense side. And then you still have the challenge of how am I going to get these two systems, even if it's on one platform, to line up the income and the expense by service line. So what's exciting to them is the fact that we have the expertise to go in and take that extraction, align it any way they want in a customized fashion, and be able to put it together in a report with drill down capabilities. And that's because we've spent years working on this kind of a technology platform that enables us to do it. When they see that you can drill down in this data with a click of a mouse, their focus shifts from how am I going to get the data to I'm going to use this data to make better management decisions and make better strategic decisions for my health system.
This type of work sounds like it's pretty heavy in analytics. Do you see our clients, typical client, having that type of expertise to be able to put something like this together on their own?
No. And one thing why I think our solution is effective, both from a technical standpoint, but also from an economic value to clients, is, let's think of it in terms, from economies of scale. We've got a lot of different clients in which we're building a system over, so the technology that we're putting is a customized technology, but we're leveraging that across a lot of different hospitals and health systems, where if they were to just take this on internally, even suggesting that they would have the skills there, they would build an entire system for just them, and that's going to be more expensive than the work that we've done where we have built this system out across a very large group of clients working at, and we can share the cost of the development, of the increase in the upgrades across a very large client base.